Hello. Welcome to the 6th installment of Spartan Step Up, CWRU Community Responds to COVID-19. This web series is coordinated by the Alumni Association of Case Western Reserve University. I'm Grover Gilmore, Dean of the Jack, Joseph, and Morton Mandel School of Applied Social Sciences. Our broadcast today will focus on how COVID-19 is affecting at-risk populations and how Case Western Reserve is assisting in that plight. We have with us today Dr. Rachel Lovell, Research Assistant Professor of the Begun Center for Violence Prevention Research and Education at the Mandel School. Welcome, Rachel. We also have with us Dr. Darcy Freedman, who's the Director of the Marianne Swetland Center for Environmental Health at the CWRU School of Medicine. Welcome, Darcy. Rachel and Darcy, I invite you to both tell us a little bit about what you're thinking about at this point.
Darcy, why don't you go ahead first?
Okay, great. Well, thank you, Dean Gilmore and Brad Cruz, for hosting this event and the opportunity to meet virtually with our alumni, staff, family, friends, community partners of Case Western Reserve University. Just as a way of introduction, I wanted to share the mission of the Marianne Swetland Center for Environmental Health. Our focus is on studying the complex interplay between the environment and human health. And in our work, we do a lot of our work within community settings. So a couple of the studies that we're working on now in response to COVID-19 include some of the work that we've been doing for a while around food systems in COVID-19, and a new study focused on childcare as a place of targeted focus in terms of reducing transmission through childcare settings. So I'm going to talk very briefly about both of those, and then I'm going to end by just giving you a brief peek into what it's like also for us in terms of teaching in the era of COVID-19. So our food systems modeling work, we have an ongoing study looking at how to promote food security in community settings. And of course, COVID-19 presented this major shock to the food system. Many of us may have experienced for the first time not being able to go to the grocery store or going to a store and not seeing everything on the shelf that we were hoping to find. We know that in many communities across the United States, that is a challenge that was happening well before COVID-19. And of course, COVID-19 exacerbated some of the inequities in food access. So we received a supplement to our work through a grant from the Foundation for Food and Agriculture Research to expand our study, looking specifically at how a common shock like COVID-19, which is extremely disruptive, has different impacts based on what your starting point was. So a community that already had really strong infrastructure to promote food security is going to experience COVID-19 differently than a community that may have had weakened or limited infrastructure. And our whole purpose in this modeling project is then to also test out different kinds of policy community solutions that might better match community need or differential community need. So that's one of the studies we have. A second study, brand new study, is called the Ohio COVID-19 Childcare Study. This is a study commissioned by the state of Ohio. It's funded by the Ohio Bureau of Workers' Compensation and done in partnership with the Ohio Department of Job and Family Services. And in this study, we're looking at 100 childcare centers in 10 counties across the state of Ohio and trying to understand how do we reduce the spread of COVID-19 in those settings. A few of the things we'll be doing in that is testing, COVID-19 testing of staff. So looking at prevalence of COVID-19. We'll also be doing surveys and interviews with families and staff in the child care centers, as well as looking at things like how child care programs are creating plans in response to this threat, COVID-19, and adapting their operations based on that. And I can talk more about that in the Q&A if you're interested. And then lastly, I just wanted to note, of course, in addition to the research we do, most of us are gearing up for the fall semester. And the fall semester looks really different this year. One of the things I value a lot about Case Western is that the majority of our teaching is actually in person in a normal school year. And in the era of COVID-19, teaching in person, is just not possible for all of our classes. I teach a graduate level seminar that's small. It's only about 10 students. And so we are going to be doing a blended model of teaching that will allow hopefully at least once a month for our class to come together. And then the remainder of our time will be done through online learning and interactions like this. So thank you.
Thank you, Darcy. Rachel, please tell me what you're focusing on now and what your concerns are.
Hi, yes. So my name is Rachel Lovell, and I am a research assistant professor at under Dean Gilmore and the Mandel School. My area of specialization is primarily about gender-based violence and a variety of aspects of how gender impacts all aspects of one's life. I'm a sociologist. My PhD is in sociology from Ohio State, and I'm a methodologist as well. I'm a research assistant professor, meaning that I just do research. I'm not tenure track. And I have a large research portfolio around gender and violence. My area of specialization is primarily around sexual assault, intimate partner violence, and human trafficking. And so as it relates to COVID-19, many of the communities that I work with in organizations, all of our work I'm from the Begun Center for Violence Prevention, Research, and Education, and all of our work is applied work, meaning that we work directly with and in the communities. So a lot of the work that I do has to have intersections with the social service sectors and the criminal justice system. So COVID has had a significant impact on all, in particular, victims of sexual assault, DV, which is domestic violence, and human trafficking. And so as it relates to the conversation we're having today, we I partnered with several other people at Case Western Reserve University to look at perhaps better ways to integrate services for victims of domestic violence and child abuse. So we know that home is not a safe place for many individuals, including adults and children. And so how do you reach individuals if they can't come to you and you can't come to them? And so really trying to figure out better models for incorporating that, as well as documenting significant changes in crime rates. If you haven't heard, crime in Cleveland has gone up dramatically. So looking at how does the intersection of crime, sexual assault, how to provide better services, and how to track these drastic changes as a result of COVID.
Oh, thank you, Rachel. Well, before we get to the questions from our audience, I can't help but notice that it seems that you're both working from home. And has this posed a disruption in your professional lives? You both have very strong research portfolios. How is it to work under these conditions?
Well, I'll just say that, and I also have two children who are school age. So it is, as we're gearing, actually had some calls with my staff this morning, as we're gearing up for the new school year, it is, I'm getting nervous again because I will say, teaching your children at your house, even if they are in a school program, but it's virtual, it does require engagement during the day, which is something that I've never had to do in my normal working schedule. And so finding that balance, it's certainly not a balance, but I think a benefit of it is that my kids know a lot more about what I do. And that my teams, I think we're all learning a lot more about each other's families and the things that are really important pieces of or a person's life. But it's not easy. And I would say the first 3 or 4 months of just figuring out how to get everything, your internet connectivity right, your chair comfortable, your setup, your room in your house. I don't think most of us thought we would be home now. I think we all thought we would be back by now. And so once we shifted in that mindset of, okay, we're here for a while, I think people sort of settled in a little bit more into the home setting.
Oh, thank you,
As someone who's
Go ahead, Rachel.
As someone who studies gender-based violence and gender-based work as well, I would say that I've been paying quite a bit of attention to some of the research coming out and some of the reports coming out about just how very disruptive this is for me personally. I also have 2 young children, a 6-year-old and a 9-year-old. And when this all started, I had a kindergartner and a 3rd grader, and you can't teach a kindergartner through PowerPoint. Like that's not how it works. And kindergartners aren't meant to be able to just entertain themselves for 8 hours. If that was the case, we wouldn't be paying. Then we would be in a different situation. And so, on a personal level, it's been extremely disruptive. I'm in a good place in that I have a partner who is able to shoulder that responsibility. But I was just talking to a reporter this morning about some of the studies coming out saying globally that this is going to have a disruption in women's careers that will last a generation. And I don't think that that's understating what's happening, especially if you look at this globally. Everyone's trying to figure out and rush to these different sorts of responsibilities, how to care for children, how to care for caregivers, what happens when you get sick, all these different things. And people are having to make these very pained individual decisions. Do I quit my job? Do I try to form some pod? Do I risk getting my parent or some childcare person or some nanny sick because of my children? All these different things that are really terrible and painful decisions for many families to make. And as we know from what happens with women bear the brunt often of the childcare responsibilities. So it's women's careers. I did my dissertation quite a bit ago on looking at what happens when women and men interrupt their careers and they have this disruption for something. And I looked at Poland, for example, after the transition from communism to their current capitalist state. And the women never recovered from that transition. They just dropped out of the labor market because when there's few jobs to go around, they tend to go to men. And they weren't really ever able to gain back the employment and the power that they had under the communism. They weren't ever really able to gain that, not even 20 years after the fall. So we know that this is going to have a very big disruptive part. And as this continues to lag on, we see that in academia and other places. So I think while it's been very hard for each of us, I think personally in many ways, for a variety of ways, I think, and I talk with my colleagues about this, I'm still in one of the best privileged positions that I can probably have, in that I have a partner who can help with this. We have stable, all the sorts of benefits of this. And so if it's this hard for us, imagine how hard it is for other people. So maybe we don't get as many publications out, or we didn't get as many grant applications out. That will definitely disrupt our careers. It's not necessarily the same as what I think many low income and more disadvantaged households are facing right now, where it's like, how do we eat? How do we maintain our household? How can we stay in our house? Those sorts of things. And so I think thinking long term, this kind of new thing is going to have a profound impact on women's careers.
I appreciate that you've shared that, Rachel and Darcy. I think it shows the depth of the impact of the pandemic, and yet you are still doing your work and you're informing others. But I'm sure these experiences will be informing your future scholarship as well.
Yeah, sure.
Let's turn to questions that we're receiving from our viewers. And it's nice that the first question actually comes from a graduate from the Mandel School, Sherry Naxon. Hello, Sherry. Glad to have you here. The pandemic has demonstrated the degree to which our society relies upon school as childcare. How do we help less resourced families have the choice to keep themselves and their children safe and at home? And her follow-up question is, what is the best practice model for communities that want to offer a daytime care to vulnerable children even though school is online? And I think given the work that you're currently doing, this would be a good question for you to pick up, Darcy.
Yeah, so I think the point that was made, and I think, reiterating Rachel's comment about the infrastructure that society had in place to support, women in particular, but people from across various groups to engage in the workforce, childcare and schools are central. And so one thing that has come out of the pandemic is this reinforced understanding of the value that these institutions play, and not only for what maybe they're most known for, so schools for education, but that they do far more than just what the primary, goal that we talk about most often. So I tend to be a person on the side of that systems were actually broken to start with or weren't working well. And so I see in some ways this kind of disruption as opportunity, because we know that these institutions have been going on for very long time and not changing, even though the outcomes they were producing weren't necessarily the best. And so for me, I am particularly excited about the childcare study because it gives us a chance in a very fast-paced nature of what's going on with COVID to take a minute and bring what research, I think a value of research to anything, but to this topic in particular, is to systematically collect information to say, what's going on? How do people feel? Where are their gaps? Where are their opportunities? And then to be able to, hopefully feedback that in a manner that allows for a broader conversation to get at the very question, what is the model we should use? I was in a call about a week ago, and it was a facilitated retreat, and the facilitator said, we are never going back to January 2020. And that is a pill that's very hard for us to swallow. We all are trying to refit into a model that is it's not possible. And we're not invoking this imagination of what the alternative could be, or we're not doing that enough. And so I think the smaller family childcare is actually a really interesting opportunity space. In terms of transmission risk, it is probably lower. You're interacting with far fewer people. You have a lot more control in terms of, the exposure points. And so, there are also ways that could be malleable and adaptive for various kinds of contexts and needs in communities. So for me, family childcare is potentially an opportunity space that deserves further examination. And a lot more people are going to engage in it through this concept of a pod, without calling it family childcare, but they're essentially creating a model of family childcare through these pod models.
Childcare further?
Sure. So family childcare is essentially childcare that's provided within the home setting. So this would be a provider who is, running childcare services within their home, and typically to a small number of children and families. So a small number of staff, a small number of children and families. It actually could be only two families with each of them bringing two kids. So that's the concept of family childcare.
Develop just among people in the neighborhood, but at some point, does it become licensed and with government rules by the state?
And there are licensing within the state of Ohio. The Ohio Department of Job and Family Services does license family as well as the bigger centers. And I think some of the things we're seeing are potential challenges with policy around licensing and funding for childcare programs. So, for example, I know many childcare programs are starting to think about providing K through 4 or K through 3 virtual educational spaces. But a challenge is that many childcare programs are not going to be able to be reimbursed for the provision of that childcare or educational support, based on pre-existing models of payment for childcare programming. So I think that's an opportunity space to really think about, here's a problem, here's a group that can offer a solution. Let's find the resources to make that solution work.
Great, thank you. We have a question from Brian Brown. This may be one for you to pick up, Rachel. Brian asks, we know the relationships between the greater medical communities and communities of color, particularly the Black community, is fraught with mistrust. What longer-term effects do you anticipate the disproportionate impact of COVID-19 is having on these communities will have on their utilization of care post-pandemic? And I think that expands not only medical care, but care in the communities in general.
I think that I think the survey, if nothing else, I think that COVID has, as Darcy mentioned, has really laid bare many of the problems that were there already. And so I can speak to, the question was about medical care, but I think I can expand it a little bit to the area that I see most, that has more to do perhaps with behavioral health and mental health services, which is a part of healthcare, I think, and many models are similar. So for example, I work a lot with the Cleveland Rape Crisis Center. And they are, they provide free services to victims or survivors of any types of sexual violence or sexual abuse. And when all of this happened, they're fairly progressive. They have, lots of adaptive models. And so they were able to move things online. And many of their clients, the more privileged clients, and the ones that were able to have high-speed internet and workspace and all that sort of stuff, were able to get services for that. But then they quickly realized that in particular for the communities of color that they serve, which is a disproportionate number of their clients, they didn't either have access to remote stuff or they just didn't feel comfortable. They didn't want to reach out in that sort of way. That wasn't the model for them. And so they had to really work and rethink about how that is, and the distrust that to necessarily assume that you're going to be able to serve clients in one sort of way, and really work towards building trust in those communities by providing services that they can access that meets their needs in a culturally sensitive way. And so I think there's a lot of stuff I think that I've seen around COVID, in particular for distrust of testing of the community, but also in contact tracing, where you get a call from the Board of Health of someone saying, hey, who do you know, in particular for communities of color and communities that have a large percentage of undocumented residents, they are not, just to assume that contact tracers are going to call you and you're going to be like, oh, I had contact with this person who lives at this house. And by the way, we have 4 families living in this house because, my sister was evicted from her house because she lost her job. And now we see this with the census as well, and the very low counts for people responding to the census. They don't, and in particular for now, their lives are completely in disarray. And to think that you're just going to trust that the community has, or that the people in the Board of Health or the medical field have your best intentions and are not going to turn you over, for example, to ICE, or, tell your landlord that you have too many people living there, or that you're just going to trust someone calling you and that they are who they say they are, and that you would give out all your contact information. So I think a lot of work needs to be done to help restore that community's trust by engaging those communities and having those conversations as it relates to COVID, and not necessarily assuming that there's a one-size-fits-all model to this, and that there's a lot of historical legacy of distrust that you need to work through before just assuming that there's engagement.
So as was mentioned before, the pandemic has really laid bare problems that we have in our system anyways. So it's actually an opportunity, with it so bare and open, to actually consciously address the problems. Trying to find the glass half full here.
Yeah, right. No, and I think that I work with lots of organizations that are really doing that great on the ground work, that are providing these services that are adaptive and that are quick to meet the needs of the clients wherever the client is, in particular for human trafficking. Human trafficking didn't slow down because of COVID, but COVID has made, in particular, juvenile human trafficking really difficult to identify and provide services for. And I work with organizations that are really adaptive and are being very innovative in that sense. I would encourage the research community, the Case Western community, to work in those communities to document these sorts of things, to see what worked, what didn't work, how can we adapt it to other jurisdictions, and how can we, to sort of learn our lessons in this so that we can sort of expand out, and that becomes the new model. Not the, like Darcy said, it's not the January 2020 model, it's the new model for providing services. And so I think, if we can, I would like to encourage the researchers and also funders, because research isn't free, to, really go in there and start to provide services to those organizations. I know we've developed some surveys for organizations, my team has, that, based on public surveys out there that they can, that we've given out to our community folks, saying, here's a survey, ask your folks what you need, how you need it, what are those sorts of things, to sort of help them capture it so that they can adapt to the needs and really assess those things. So the research community has a role in this as well, to really say, this is our community as well. What can we do to help the people who are on the front lines?
One of the areas that we know the pandemic has really brought to our attention is the digital divide. There are people such as ourselves who do have internet at home, who have good connections, but others who don't. Shirley Reynolds raises this question. She asks, what initiatives has the university or people at the university taken to help address this digital divide? Are you aware of any initiatives, Rachel or Darcy?
I'm aware of some initiatives. I haven't been directly involved. I know Dean Gilmore, we were involved in early conversations about how CASE could leverage and what are the options and how internet connectivity, because we're sort of spatially, we're in areas that doesn't often have good internet access and high speed. It's a complicated issue. It's not just a matter of, sort of setting up, hotspots or whatever. I'm not involved directly with that, but I have been reading stuff and work with others in the School of Medicine who are working with people in the community. And I know there was recently a grant funded from the Gun Foundation and maybe the Cleveland Foundation, some others, to work to really, I read it in the cleveland.com about really increasing digital connectivity, but I'm not the one that's involved with that, but I think it's a very pressing issue for exactly the reasons we just talked about, to just assume that people are going to be able to be online. And for our students, the same thing, just assume that they're going to have great internet access. I think we have to all change those expectations. And the digital divide, bridging that digital divide is one of the first areas to do that.
Yeah, I'll just make one comment on that, of where, something we've done from our research side is map out. So I mentioned earlier, our center does a lot of work around food security. So looking at where people across the state of Ohio live in terms of, the number of people who are receiving SNAP or Supplemental Nutrition Assistance Program, that's an indicator of need for food assistance, and access to computers, Wi-Fi, high-speed internet, things like that. And, really starting to shed light into pockets of our state where, we're saying, hey, a solution is to order your groceries online. And even there was a period where people, early on, well, you should only go to the grocery store once a week. Well, if you happen to live in those areas, that is not a solution that's available to you. And so, helping to shed light onto the complexity of the problem. And, in certain particular areas of our community, we need to be moving beyond only an online solution. So in one of our community partner calls, they said in some neighborhoods, you literally are going to need to go down and get on the bullhorn and drive down the road and tell people what they need to know, because you can't assume they're going to get it on the internet or any other kind of virtual communication system. So kind of going old school and not only relying on virtual as the pathway to disseminate. And I think back to the question about building connections and trust with the community, it's the same thing, like figuring out, and we do not have an answer to this yet, but how do we get out of our homes? Because the way that we do work well with community it wasn't by sitting in our office at Case Western. It's certainly not sitting in our house. It's about being together. But it is still very difficult to figure out, well, what's the best way to be together, in this era of physical distancing.
Yeah, we're all struggling with that, and we want to be together.
Yes.
When I think about the digital divide, and what the university is doing, when we adopted a Wi-Fi network, an early decision was to actually make it available to everybody within the geographic area of the campus. And so now anyone who comes within the geographic area can sign on to Wi-Fi using Case Guest. And it's a very high speed connection. And so while that doesn't solve it for all the community, at least people who can find their way here, even in sitting in your car, you can use that network. So that's a contribution. Let's bring this down to the individual level. We have a question that came in from Carl Teisel, who is concerned about what people who are living alone can do to better cope with the situation. Is there something that they should prepare for now, or services in particular that they should be looking for?
Rachel, do you want to start?
Sure. Yeah, I would say since a lot of the work that I do isn't necessarily around just the sort of viral transmission and the sort of more physiological aspects of COVID, but instead the sort of trauma and the larger structure around that. I would say there's the aspect of disease transmission, which what we're actually seeing is the scientific method being played out in real time. And I have constant conversations with my husband about, whatever study came out, and we will, whenever we get a break from our children, which is about every 5 minutes at a time, we'll sit down and he'll say, here's this new study. What do you think this means? Like, does this mean kids are getting it? Kids are not getting it? What is this? And, this is the scientific method where studies are coming out in real time, and the science community is trying to decide where is that transmission, and work like that Darcy's doing around with children is extremely important, because we don't know a lot about this. We don't know where is the safest, and recommendations are changing. So that is playing out in real time. I think for the protection stuff, I think for someone living alone, this is a traumatic event. It's a traumatic event in every person's life, and it has affected all of us, some more than others. But this is a cleavage that will be felt for, like I said, for a generation. It's like that the Great Depression and these other, wars. This is that kind of event, I think, for society, for the whole world. And so, you have to know that this is going, as an individual, is going to impact you, and you're going to likely be seeing some trauma responses to isolation, because we're not also meant to be isolated in our homes. And so, really protect. And I do work with sexual violence, and so I know sometimes those trauma symptoms aren't exactly present, but they're sort of on the background, sort of secondary victimization. And so those things can come out in a variety of ways that you may not initially tie to the trauma of isolation or loneliness or loss of connectivity or loss of structure or loss of a schedule. So To me, it's more about making, being cognizant and learning more about what trauma symptoms are, how they may be impacting you, and then moving forward, how to approach, getting help and resources if you need those. And there's lots of organizations that I can recommend depending on the type that were able to provide services. But then really, trying to make sure that you make connections to humans, because that loss of human connection can be one of the most profound things that can happen to a person, and your mental health can spiral for sure from that. So really trying to find whatever ways that can be to find that connection to people, even if it's remote, even if it's calling people, even if it's, trying to be just around people in a socially distance area is really important. So those are the things I would do for individuals, recommend for individuals who are isolated or perhaps by themselves more than they would be before this.
That's good advice, that you may be physically isolated, but you don't have to be socially isolated.
Mm-hmm.
We can reach out to people. I know that a number of neighborhoods have formed parties where people simply go out on their porches or stand on their front steps, and they talk to one another
Mm-hmm.
across the streets, and kids
Mm-hmm.
play that way. So we are social creatures, and we need to find ways to maintain that. Thank you. We have a question from Khalid Kader, who is an alumnus who's living now in Minneapolis, the Minneapolis area. And he's asked us to discuss the nexus between the pandemic and recent social unrest. He's particularly concerned because he's considering ways that he might be able to make a positive contribution, but he needs to understand some more about what the perspective is on this problem for people living in an urban area.
I can offer, just, kind of building on some of our research and more in the food system space. As our team sort of talks about this idea of crisis. So as Rachel mentioned, this is a traumatic event. It's just a crisis moment. It's a shock. There are two ways you can think about the crisis. There is this acute crisis. I mean, COVID was an acute crisis. It may become it's becoming a chronic crisis where it lags. But there are also these smoldering crises that have been going on for generations. And we happen to be at a moment where both of those collided. And I think it's really important to recognize that the smoldering crisis has been going on for a very long time. And it can be difficult if you were affected directly by the smoldering crisis of racial inequity, that you could see, wow, this entire country pivoted on a dime in March of 2020. It is possible, right? Like, it's possible to shut our system down. I mean, and for people that have been in that smoldering crisis, that is difficult it's like, how much more did we need to say and do and communicate to say this other crisis was going on? And so I think being aware that both of these are both really, really important. But a lot of what because I deal a lot with food insecurity, if you're hungry, you need food now. You don't need food in a month or a year, or 3 years. And then secondly, but you have to also be thinking about the both and, that there's the solutions that put food on my table today, and then the things that are going to make it that I don't need food in the future. And how are we doing both of those? And so for many families, and I think about this for my life as a parent, I know for a fact COVID-19, I don't know if anyone in my family will get COVID-19, but I know for a fact that we will be affected by the what's going on with our schools. and the disruption that that causes. And so if you're only talking to me about COVID-19 as a virus, you're not resonating with my full set of needs. And I think similarly, this balance of racial equity, crises, and COVID-19, like you have to attend to the thing that I know for sure is going to happen. And I might also get COVID-19, but I know for sure these inequities are there. And so I think, how do we strategically address both? Not everything is going to address both of them equally, but to be aware that these are both going on.
Thank you.
I would say, I think if Dean Gilmore, if I think I understood the question or comment correctly, it's really like how can this person kind of balance both of these at the same time, or sort of help contribute to that? So, I mean, psychologically, these sorts of things are going to take massive toll. So hearing just, seeing videos of George Floyd's death and all these sorts of things are going to, sort of take a toll on someone, as well as this constant fear and anxiety of COVID and how disruptive that is. That can make all of 2020 just feel like you want to redo, like, let's just start over and can we erase 2020 or whatever. So I think in some ways that there is an opportunity to get on the other side of that overwhelm and hopelessness. And I think the racial injustices and the protests and the conversations being had around that are really and can be opportunities to channel of feeling, well, what can I do in this situation? Because COVID is very much like, there's only so much some people can do. And then there's some stuff that it kind of has to play itself out. But people can make a conservative effort to, as it relates to voting or politics, racial injustice, texting people, calling people. There are giving money. There's very tangible things that can help overcome feeling overwhelmed by all of these sorts of things. And so by having a plan and taking action and finding a community, wherever that community is, that coincides, that go along with whatever that person's passion is, whether it's, finding rescue dogs, homes during unrest or whatever, that can really work towards that. So I would say, encourage trying to channel the anxiety that COVID is bringing and all the bad news in the world to things that to small scale individual of what can I do? Where's my place? How can I make a little bit of a difference? And I think that can go a long way.
Well, that's a great point. It's also a way of dealing with the isolation issue. If we find a place where we feel that we can make a contribution, however that might be, then we can feel better about ourselves and we're engaged. And it's something to get up for every day where you feel that you're making a difference. Believe it or not, we're down to our last question. This time's gone by very quickly. And that last question is going to come from Tom Cross. And he wants to know our reaction to the community pod model, where parents pool resources to educate children in the community as an alternative to traditional schools. Darcy spoke earlier about parents coming together with family care. I guess that would be a family care pod model. Now this is thinking about it, I believe, expanding it to actually full-scale education. Either of you want to comment on that?
I mean, I think that this is something that should be looked into more. I think there's a lot of opportunity. One concern or one potential risk I would want to or unintended consequence I would want to pay attention to is the, equity, just to the question that was just asked. Do the model, like who has the capacity to organize a pod? It's not everybody does. And those people who do might get in a better podding situation than those people who don't. And so this is where I think these are public goods. If we think it's a public good, like where's the public space that gets supported? So it's not only on the backs of the families who have the resources to organize the best family pod. But I think as a concept, as a reimagined way of education and engagement and community, and how do we even bring in people from across generations, and some folks who are feeling isolated and might have a bit more time that they could contribute in this space. Like, I think it's a great space of innovation. And one of the things I've been thinking about a lot, and I hope at Case Western we could maybe find a way to make this happen. In other areas, when we've thought about innovation, you think about entrepreneurship. And one of the most interesting quotes I ever heard from an entrepreneur is that, and he was a very successful entrepreneur, 9 out of 10 of my ideas will fail. But people are giving a little bit of resource to innovate an idea. And I would love to see that. I think this is a strength of Case Western entrepreneurship, more in the business sector. But how do we bring that into childcare and into schools and help facilitate ideation and quick failures, so that we can get to some really interesting new ideas. And I would love to see our university be a big part of that conversation.
I would say just organically, we have a bunch of kids that live on our block, and my kids play with their kids. And even organically, I've already engaged several of the parents around the neighborhood to say, hey, now we know we live in Bay Village. Now I know, we're not starting back. Doesn't it make more sense if we take turns with the responsibility, so that at least some of us, I would rather teach 4 kids at a time and get and just get the 2 hours or 3 hours out of the way. And then maybe the next day I can actually have some time to work and that sort of stuff. But it's exactly as Darcy said, that entails all the privilege of being able to organize and feel comfortable with people being there and all the things that go along with that, which, and asking people to do that on their own and on the backs of their strained system isn't really fair. I have heard and have seen about both in the criminal justice system and the child welfare system, how the rates of reported child abuse have gone down by at least half. And that's fairly consistent across different jurisdictions. And they're not going down because there's less child abuse. They're going down because no one is in the household or able to see the children anymore. So schools were the number one place where child abuse is reported. No one is seeing those children because they're in those households. And in fact, the National Child Abuse Hotlines are reporting that it's actually teenage children who are often calling in reporting because they're the ones that can call and be able to text and different things, just how much abuse is going on in the household. So I worry with some of the pod stuff that there isn't some sort of oversight or regulation in terms of how and what's being done. And then also allowing the schools and or some sort of system to responsibly be in people's homes where they can start to observe and start to notice when children are not, or perhaps, victims of abuse and other sorts of things, because we know that with all the stress and all that sort of stuff that children and other less vulnerable are going to be the victims. And, they're going to die in households if they're not able to observe the violence before it escalates. So I think the pod system is good for individuals, but there needs to be a bigger systematic way of being able to address that by allowing, children to be able to be, abuse to be identified and, or lack of food and or other sorts of basic services that are needed, because schools play a crucial role in that. So I don't know that schools necessarily should take on that much more responsibility, because we're already asking the school systems to do things that they weren't designed to do. But if we really want people to be safe, we really have to meet those basic hierarchy of needs first, before they can even start to learn, what's a simile and what's a metaphor, right? Like that's the secondary compared to the basic safety. So I think the pods are a great idea and a great innovation in that. But I would like to see some more systematic ways. So it's not just one mom texting another family saying, "Hey, do you want to come over on Tuesday and I'll watch the kids?" That's not really sustainable in the long term.
Well, I can tell that there's so much more that we can talk about,
Yeah.
because while we're talking about the families coming together and providing resources, we're also seeing what we're losing because the children are not in school and they're not being fed. Many rely on breakfast and lunch. That's where their food security is. And as you point out, the incidents of child abuse that's reported by teachers and nurses in the school is very important. So, and yet there's going to be an adjustment that's going on. And I think, going back to one of the last questions we had about what can I do and what we can do as citizens is to keep up our awareness of what these problems are and realize that it's not the problems of others, it's our problems, and we all need to work together. I'm being told that we're at our end, so I want to thank Darcy and Rachel for joining us today for this episode of Spartan Step Up. If you have or would like more information on either of the initiatives that our Darcy Freedman and Rachel Lovell have been discussing, or you want to know more about what we're doing in the Alumni Association, please do contact us. The contact information will be posted on the screen momentarily. Your comments will be forwarded on to me and to our panelists. So thank you all for joining us today, and we hope you all stay well and have a good end of the summer. Take care.